And with another surge most likely on the way, are there enough beds and enough staff?
CBS 13's Julie Watts is getting answers. Julie?
Yeah, guys, with 2 to 3 weeks to prepare for a potential hospital surge, that COVID clock is ticking, and it's still not entirely clear if we have the resources we need.
You can see if we project out to Christmas Eve, we are projecting we'll get to 78% capacity, but that doesn't tell the whole story.
And preparing for the anticipated COVID surge isn't a simple story either. According to the state dashboard, the number of COVID-positive hospitalized patients as of this weekend had surpassed the peak back in July by more than 600 patients. But we do have a few hundred more available ICU beds now than we did during the summer surge. Will that be enough should we see this predicted surge within a surge?
It is very dependent on who is getting sick.
Sac County's Dr. Cassirier says during the summer surge, most of the hospitalized patients were elderly. This time around, we're seeing an increase in younger hospitalized COVID patients who aren't as likely to end up in the ICU. But of course, bed counts vary greatly by county. While the dashboard shows Sacramento with 316 COVID patients and 76 available ICU beds, Yuba Sutter has 38 COVID patients with just 2 available ICU beds. Now, the state says there are an additional 3,000 warm status hospital beds in alternate care sites like Sleep Train and field hospitals. But it's also important to note just because you have enough beds doesn't mean you have enough people to staff them. We saw that this summer in Stanislaus County.
Yeah, and that's why we're all very concerned. We're seeing the surge in almost every single county. We're all going to need the additional help at the same time, so that will very quickly deplete the additional surge capacity.
Now, this summer, the state relied largely on federal resources to help staff understaffed hospitals. They didn't use the California Health Corps. Today, however, the governor said those federal resources are stretched thin. And so far, we have 871 Health Corps members that are registered and ready to serve the entire state.
Julie Watts live tonight for us. Julie, thank you.